Hi and welcome viewers of Nursing Academy 101. In this video we'll talk about maternity related multiple choice questions for nurses along with the answers and rationales. Part 1. But before we start, please don't forget to subscribe, like and share the channel to encourage us to continue and provide you with all new. Question number 1. A pregnant client in her third trimester is admitted to the hospital with preterm labor. The nurse should prioritize which intervention: A. Administering glucolytic medication. B. Placing the client in Trendelenburg position. C. Assessing fetal heart rate with a Doppler. D. Assisting with amniocentesis. The answer is A. Administering glucolytic medication. Glucolytic medication is used to inhibit uterine contractions and prevent preterm labor. It helps delay labor and allows for administrations of corticosteroids to enhance fetal lung maturity. Placing the client in Trendelenburg position may impede blood flow and is not the appropriate intervention. Assessing fetal heart rate is important but not the priority at this time. Assisting with amniocentesis is not indicated unless there is a specific medical reason. Question number 2. A postpartum client reports having painful uterine contractions while breastfeeding. The nurse should provide which explanation? A. This is a normal sign that your uterus is returning to its pre-pregnancy size. B. Breastfeeding causes your body to release oxytocin, which can cause uterine cramping. C. You may be experiencing complications and I will inform the healthcare provider. D. I will administer pain medication to help relieve your discomfort. The answer is B. Breastfeeding causes your body to release oxytocin, which can cause uterine cramping. Breastfeeding stimulates the release of oxytocin, which causes the uterus to contract. These contractions, known as after pain, help the uterus return to its pre-pregnancy size. It's a normal physiological process, and no further intervention is necessary. Pain medication may be used if the pain becomes excessive, but it's not the initial response. Question number 3. A nurse is caring for a postpartum client who gave birth 48 hours ago. The nurse assesses the client's vital signs and notes a temperature of 100.4 Fahrenheit, 38 degrees Celsius. What action should the nurse take? A. Administer an antipyretic medication to lower the temperature. B. Document the finding as a normal postpartum variation. C. Notify the healthcare provider. D. Encourage the client to increase fluid intake. The answer is C. Notify the healthcare provider. A temperature of 100.4 Fahrenheit, 38 degrees Celsius, or higher after the first 24 hours postpartum may indicate an infection. It's essential to notify the healthcare provider to assist the client further and initiate appropriate intervention. Antibiotics medication should not be administered without a healthcare provider's order. Documenting the finding as normal or encouraging fluid intake is inappropriate in this situation. Question number 4. A client at 28 weeks of gestation is scheduled for a non-stress test (NST). Which statement by the client indicates an understanding of the test purpose? A. The test will determine if I am at risk for gestational diabetes. B. The test will assess the baby's overall development and growth. C. The test will monitor the baby's heart rate and movement. D. The test will measure the amount of amniotic fluid around the baby. The answer is C. The test will monitor the baby's heart rate and movement. A non-stress test (NST) is used to assess the baby's well-being by monitoring the fetal heart rate and movement. It helps determine if the baby is receiving adequate oxygenation and is an important tool for evaluating fetal health. Gestational diabetes, overall development and growth, and amniotic fluid assessment are not the specific purpose of an NST. Question number 5. A pregnant client at 36 weeks of gestation is diagnosed with preeclampsia. The nurse should prioritize which intervention? A. Encouraging the client to lay on her left side. B. Administering antihypertensive medication. C. Restricting fluid intake. D. Initiating magnesium sulfate therapy. The answer is A. Encouraging the client to lie on her left side. In preeclampsia, positioning the client on her left side helps improve blood flow to the placenta and reduce pressure on the vena cava, enhancing fetal oxygenation. Antihypertensive medication, fluid restriction, and magnesium sulfate therapy may be components of the treatment plan but are not the initial priority. Question number 6. A nurse is assessing a newborn for signs of respiratory distress. Which finding should the nurse consider as an early sign of respiratory distress in a newborn? A. Nasal flaring. B. Grunting. C. Cyanosis. D. Bradycardia. The answer is A. Nasal flaring. Nasal flaring is an early sign of respiratory distress in a newborn. It indicates that the baby is attempting to open up the airway to facilitate breathing. Grunting, cyanosis, and bradycardia are more severe signs of respiratory distress and may indicate inadequate oxygenation. Question number 7. A pregnant client at 39 weeks of gestation is admitted to the labor and delivery unit with ruptured membranes and a prolapsed umbilical cord. The nurse should prioritize which intervention? A. Preparing the client for an immediate cesarean section. B. Placing the client in a knee chest position. D. Administering glycolytic medication. D. Applying gentle upward pressure on the presenting part. The answer is B. Placing the client in a knee chest position. In the case of prolapsed umbilical cord, the nurse should immediately relieve pressure on the cord by placing the client in a knee chest position or in a modified redevelopment position with the hip elevated. This helps to reduce compression of the cord and maintain blood flow to the fetus. Preparing for a cesarean section may be necessary, but is not the immediate priority. Administering glycolytic medication is not indicated in this situation. Applying gentle upward pressure on the presenting part is an outdated practice and is not recommended. Question number 8. A postpartum client who gave birth 12 hours ago reports sudden shortness of breath and chest pain. The nurse suspects the client may be experiencing a pulmonary embolism. What is the nurse priority action? A. Administering oxygen via nasal cannula. B. Notifying the healthcare provider immediately. C. Performing a thorough respiratory assessment. D. Assisting the client into a high Fowler position. The answer is A. Administering oxygen via nasal cannula. In a suspected pulmonary embolism, the priority action is to ensure adequate oxygenation. Administering oxygen via nasal cannula can help improve oxygen saturation and relieve the client's symptoms. Notifying the healthcare provider and performing a respiratory assessment are important actions, but shouldn't delay the provision of oxygen. Assisting the client into a high Fowler position may be appropriate but should be done after ensuring oxygen administration. Question number 9. A pregnant client in her second trimester asked the nurse about travel restrictions during pregnancy. What is the nurse's best response? A. You can travel without any restriction during your second trimester. B. It's best to avoid any long-distance travel during pregnancy. C. You should consult with your healthcare provider before making any travel plan. D. It's safe to travel until you reach 36 weeks of gestation. The answer is C. You should consult with your healthcare provider before making any travel plans. Travel restrictions during pregnancy can vary depending on factors such as the client's medical history, gestational age, and the mode of travel. It's always recommended for a pregnant individual to consult with their healthcare provider before making any travel plan. The healthcare provider can provide personalized advice and guidance based on the individual's specific circumstances. Question number 10. A breastfeeding client asked the nurse about effective latch and positioning techniques. Which statement by the client indicates a need for further education? A. I should bring the baby to the breast with their mouths wide open. B. I will ensure that the baby's lips are flanked outward while breastfeeding. C. I should only offer one breast per feeding session. D. I will position the baby's body in line with my breast while feeding. The answer is C. I should only offer one breast per feeding session. It's important for breastfeeding clients to offer both breast during a feeding session to ensure adequate milk transfer and stimulation of milk production. Breastfeeding from both breasts helps provide hand milk, which is rich in fat and essential for the baby's growth and development. Question number 11. A pregnant client at 32 weeks of gestation is diagnosed with gestational diabetes. Which instruction should the nurse provide to the client regarding blood glucose monitoring? A. Check your blood glucose level once a week. B. Monitor your blood glucose levels before meals and at bedtime. C. Check your blood glucose levels only if you feel symptoms of high or low blood sugar. D. Monitor your blood glucose level after meals and at random times during the day. The answer is B. Monitor your blood glucose levels before meals and at bedtime. Clients with gestational diabetes should monitor their blood glucose levels regularly to assess glycemic control. The recommended times for monitoring include before meals and at bedtime. These specific times provide valuable information about fasting and pre-prandial blood glucose level, which can guide dietary adjustments and medication management. Monitoring once a week, only when symptoms occur, or after meals and random times during the day doesn't provide adequate information for managing gestational diabetes. Question number 12. A nurse is caring for a postpartum client who delivered a healthy newborn. The nurse should assess the client for which potential complication related to the third stage of labor. A. Postpartum hemorrhage. B. Perineal laceration. C. Retained placenta. D. Urinary tract infection. The answer is C. Retained placenta. Retained placenta is a potential complication during the third stage of labor. It occurs when the entire placenta or fragments of it remains in the uterus after delivery. This can lead to postpartum hemorrhage. Perineal laceration and urinary tract infections are more commonly associated with the second stage of labor and the postpartum period. Question number 13. A pregnant client with human immune deficiency virus HIV asked the nurse about preventing transmission of the virus to the baby. What is the nurse's best response? A. You will need to have a cesarean section to prevent transmission of the virus. B. You should avoid breastfeeding to prevent transmission of the virus. C. Taking antiretrovirus medications during pregnancy can greatly reduce the risk of transmission. D. Transmission of HIV to the baby can be prevented. The answer is C. Taking antiretroviral medications during pregnancy can greatly reduce the risk of transmission. Taking antiretrovirus medication during pregnancy is an essential component of preventing mother-to-child transmission of HIV. These medications can significantly reduce the viral load in the mother, decreasing the risk of transmission to the baby. While a cesarean section may be recommended in some cases for further reduce the risk, it is not the only preventive measurement. Breastfeeding is generally contraindicated in clients with HIV, as it can transmit the virus to the baby. However, the primary focus of the response is on medication therapy to reduce transmission. Question number 14. A newborn is diagnosed with a cleft lip and palate. Which intervention should the nurse prioritize? A. Initiating bottle feeding to promote adequate nutrition. B. Providing emotional support to the parents. C. Ensuring proper airway management. D. Scheduling a surgical repair as soon as possible. The answer is C. Ensuring proper airway management. Ensuring proper airway management is a priority in newborn with cleft lip and palate. These structural abnormalities can affect breathing and feeding, and the nurse should assess and maintain a patent airway. Bottle feeding, emotional support, and scheduling surgical repair are important interventions, but they are secondary to ensuring adequate respirations and airway clearance. Question number 15. A nurse is providing care to a pregnant client with preeclampsia. The healthcare provider prescribes magnesium sulfate for seizure prophylaxis. Which assessment finding should the nurse prioritize? A. Urinary output. B. Deep tendon reflexes. C. Blood pressure. D. Fetal heart rate. The answer is B. Deep tendon reflexes, DTR. Magnesium sulfate is a common medication used for seizure prophylaxis in a client with preeclampsia. However, it can cause toxicity, resulting in depressed reflexes and central nervous system depression. Monitoring the client's DTR is crucial in detecting early signs of magnesium sulfate toxicity, while urinary output, blood pressure, and fetal heart rate are also important to assess. Monitoring the DTRs takes priority in this situation. Question number 16. A postpartum client requests a prescriptions for combined oral contraceptives (COCs) during the lactation period. What is the nurse's best response? A. COCs are not recommended during breastfeeding due to potential effects on milk supply. B. You can safely use COCs as a form of contraception while breastfeeding. C. It's best to use barrier methods of contraception instead of COCs during lactation. D. COCs are contraindicated during the postpartum period due to the risk of blood clots. The answer is A. COCs are not recommended during breastfeeding due to potential effects on milk supply. Combined oral contraceptive COCs containing estrogen are generally not recommended during breastfeeding as they may decrease milk supply. Progestin-only contraceptives, such as the mini pills, are preferred for breastfeeding individuals as they don't affect milk production. It's important to provide accurate information to the client and discuss suitable contraceptive options during the lactation period. Question number 17. A pregnant client with gestational diabetes asks the nurse about managing her blood glucose levels through diet. Which dietary instruction is most appropriate for the client? A. Avoid carbohydrates completely to control your blood sugar. B. Consume small, frequent meals with a balance of carbohydrates, protein, and healthy fats. C. Increase your intake of sugary foods to maintain stable blood sugar levels. D. Consume a high-protein diet with minimal carbohydrates. The answer is B. Consume small, frequent meals with a balance of carbohydrates, protein, and healthy fats. For clients with gestational diabetes, the recommended dietary approach is to consume small, frequent meals that include a balance of carbohydrates, protein, and healthy fats. Completely avoiding carbohydrates or following a high-protein, low-carbohydrate diet is not appropriate. It's essential to provide adequate nutrition while managing blood sugar levels through portion control, carbohydrates counting, and making healthy food choices. Question number 18. A newborn is diagnosed with jaundice shortly after birth. Which intervention is appropriate for managing neonatal jaundice? A. Encouraging frequent breastfeeding to enhance bilirubin elimination. B. Initiating phototherapy to promote the breakdown of bilirubin. C. Administering iron supplement to improve bilirubin metabolism. D. Placing the newborn in a cool environment to reduce bilirubin levels. The answer is B. Initiating phototherapy to promote the breakdown of bilirubin. Phototherapy is the standard treatment for neonatal jaundice. It helps to break down bilirubin in the skin, allowing it to be excreted from the body more easily. Frequent breastfeeding can help with hydration and elimination. Question number 19. A pregnant client at 38 weeks of gestation arrives at the labor and delivery unit with contractions occurring every 2 minutes. The nurse performs a vaginal examination and finds that the client's cervix is dilated to 8 cm and 100% effaced. What is the nurse's priority action? A. Prepare the client for immediate delivery. B. Assess the client with breathing techniques. C. Assess the fetal heart rate. D. Administer pain medication. The answer is C. Assess the fetal heart rate. When caring for a client in active labor, the nurse's priority action is to assess the fetal heart rate. This helps determine the well-being of the baby and identify any signs of fetal distress. While preparing for delivery and providing comfort measures are important, ensuring fetal well-being takes precedence. Pain medication can be administered after assessing the fetal heart rate. Question number 20. A postpartum client who had a cesarean section is experiencing difficulty passing gas and having bowel movements. The nurse should implement which intervention? A. Encouraging ambulation and activity. B. Administering a stool softener. C. Withholding oral intake. D. Applying an abdominal blinder. The answer is A. Encouraging ambulation and activity. Encouraging ambulation and activity is an effective intervention to help stimulate bowel motility and relieve post-operation gas and constipation. It promotes peristalsis and assists in the return of bowel function. Administering a stool softener may also be appropriate, but ambulation and activity are the priority. Withholding oral intake and applying an abdominal binder are not the most appropriate interventions for addressing this issue. Question number 21. A breastfeeding client asks the nurse about nipple care. Which instruction should the nurse provide? A. Clean the nipples with soap and water before each feeding. B. Apply lanolin cream to the nipples after each feeding. C. Air dry the nipples after each feeding. D. Alternate breast during feeding to prevent nipple soreness. The answer is C. Air dry the nipples after each feeding. After each feeding, the client should air dry the nipples to promote healing and prevent moisture-related complications. Cleaning the nipples with soap and water before each feeding can strip away natural oils and cause dryness and irritation. Lanolin cream can be applied if the nipples are dry or cracked, but air drying is the initial priority. Alternating breasts during feeding is unrelated to nipple care and is instead a strategy to ensure balanced milk supply. Question number 22. A pregnant client at 36 weeks of gestation is admitted to the antenatal unit with severe preeclampsia. The nurse should prioritize monitoring for which potential complication? A. Fetal distress. B. Maternal hemorrhage. C. Hypoglycemia. D. Maternal thrombosis. The answer is A. Fetal distress. Severe preeclampsia can have adverse effects on fetal well-being. Monitoring for fetal distress is a priority to ensure timely intervention and prevent complications. Maternal hemorrhage, hypoglycemia, and maternal thrombosis are potential complications but are secondary in priority compared to monitoring fetal distress. Question number 23. A pregnant client at 32 weeks of gestation presents to the antenatal clinic reporting severe back pain, decreased fetal movement, and vaginal bleeding. The nurse suspects placental abruption. What should be the nurse's immediate action? A. Administer pain medication to the client. B. Prepare the client for an emergency cesarean section. C. Place the client in a left lateral position. D. Start an intravenous line and initiate fluid resuscitation. The answer is D. Start an intravenous line and initiate fluid resuscitation. Placental abruption is a medical emergency that requires immediate intervention. Starting an IV line and initiating fluid resuscitation is the nurse's priority action to stabilize the client's condition. This helps maintain blood volume and perfusion to the placenta and fetus. Administering pain medication, preparing for a cesarean section, and placing the client in a left lateral position may be necessary intervention, but fluid resuscitation takes precedence to address potential hypovolemia and fetal compromise. Question number 24. A postpartum client with a second-degree perineal laceration requests pain relief. Which nursing intervention is most appropriate? A. Administering an opioid analgesic. B. Applying an ice pack to the perineal area. C. Assisting the client with warm sitz baths. D. Providing distraction techniques such as music or television. The answer is B. Applying an ice pack to the perineal area. Applying an ice pack to the perineal area is an effective nursing intervention for providing pain relief following a perineal laceration. Cold therapy helps reduce inflammation and numb the area, providing comfort to the client. Administering an opioid analgesics may be necessary in some cases, but not pharmacological measures like cold therapy should be attempted first. Warm bath can be used later in the healing process. Distraction techniques can be helpful, but they don't directly address the client pain. Question number 25. A pregnant client at 28 weeks of gestation is diagnosed with gestational hypertension. The client asked the nurse about the potential effects on the baby. What is the nurse's best response? A. Gestational hypertension can lead to preterm birth and low birth weight. B. The baby will not be affected as long as you take medication to control your blood pressure. C. Gestational hypertension doesn't have any impact on the baby. D. You may need to undergo a cesarean section due to gestational hypertension. The answer is A. Gestational hypertension can lead to preterm birth and low birth weight. Gestational hypertension can have adverse effect on the baby. It's associated with an increased risk of preterm birth and low birth weight. While taking medication to control blood pressure is important, it doesn't eliminate the potential impact on the baby. Gestational hypertension is a significant concern that requires close monitoring and management throughout pregnancy. A cesarean section may be necessary in certain cases, but is not a direct effect on gestational hypertension. Question number 26. A breastfeeding client reports engorgement and breast pain. What should the nurse suggest to alleviate these symptoms? A. Applying cold compresses to the breast. B. Reducing breastfeeding frequency and duration. C. Expressing breast milk before feeding. D. Supplementing with formula to relieve breast fullness. The answer is C. Expressing breast milk before feeding. Expressing breast milk before feeding, also known as hand expression or pumping, can help relieve breast engorgement and pain. This reduces breast fullness and makes it easier for the baby to latch onto the breast. Applying cold compresses can provide temporary relief but doesn't address the underlying issue of milk accumulation. Reducing breastfeeding frequency and duration or supplementing with formula can interfere with milk supply and should be avoided unless medically necessary. Question number 27. A pregnant client at 39 weeks of gestation arrives at the labor and delivery unit with ruptured membranes. On assessment, the nurse notes a prolapsed umbilical cord. What is the nurse's immediate action? A. Place the client in a Trendelenburg position. B. Initiate continuous electronic fetal monitoring. C. Administer oxygen to the client via a face mask. D. Push the presenting part of the fetus off the umbilical cord. The answer is D. Push the presenting part of the fetus off the umbilical cord. In the case of prolapsed umbilical cord, the nurse's immediate action should be to relieve pressure on the cord by pushing the presenting part of the fetus off the cord. This helps restore blood flow to the baby and prevents fetal compromise. Placing the client in a Trendelenburg position can exacerbate the situation and is contraindicated. Continuous electronic fetal monitoring and administering oxygen are important interventions but are secondary to relieving pressure on the cord. Question number 28. A postpartum client who had a vaginal delivery is experiencing excessive bleeding. The nurse suspects uterine atony. What intervention should the nurse prioritize? A. Administering oxytocin, pitocin intravenously. B. Assisting with fundal massage and expressing clot. C. Prepare the client for a blood transfusion. D. Administering a uterine relaxant medication. The answer is B. Assisting with fundal massage and expressing clots. Uterine atony, characterized by the lack of uterine muscle tone, is a common cause of excessive postpartum bleeding. The nurse priority intervention is to assist with fundal massage and expressing clots to stimulate uterine contractions and control bleeding. Administering oxytocin can also help with uterine contractions and is often done concurrently with fundal massage. Preparing for a blood transfusion may be necessary if bleeding continues, but addressing uterine atony is the immediate priority. Administering a uterine relaxant medication would be contraindicated as it would further worsen uterine atony.